Welcome, everybody. My name is Dr. Sarmen Sarkissian. I'm a hematologist oncologist here working in Los Angeles and Ventura County. I am the chair of the membership and mentorship committee of the Armenian American Medical Society. So a few months ago, we decided to start a video series where we start interviewing a lot of the students in our pre-health organization that we're really proud of and are going to have very strong, aspiring careers. And we're tracking them across the entire spectrum. We've interviewed students that are currently in undergraduate, those who just took the MCAT, those who just took the DAT, those who just went through a successful application cycle, started medical school or dental school, those who are currently in dental and medical school. And now we're moving on to the next phase, and we're lucky to have a couple of people that have already graduated from professional school and they're entering into their postgraduate years. And today I'm lucky enough to have Dr. Mirna Kalayjian. I've known her for several years, and she just finished pharmacy school at UCSF, and she's here to talk about her experiences. So, Mirna, do you want to introduce yourself real quick?
Yes, thank you, Sarmen, for that introduction. Thank you for having me. My name is Mirna Kalayjian, as Sarmen mentioned. I just graduated from pharmacy school from UCSF, and I am currently working as a fellow in global drug development in oncology at Bristol Myers Squibb. So thank you for having me.
Very good. You bring a really unique set of experiences, which I think people are going to be really appreciative when they listen to this video series. So before we go on to some of the juicier things, tell us about how pharmacy school compared to undergraduate. There's hundreds of students that are right now at CSUN, USC. Some of them are at community college and they're dreaming of getting into pharmacy school, but taking a biology class and general chemistry class has no sort of like direct relation to what some of these pharmacology classes are like, or the some of the clinical classes. So how did it compare when you hopped over to pharmacy school?
Yeah, you already touched on a lot of good points. It's drastically different especially in the mindset that you are in. Pharmacy school is a professional school. When you enter, you are kind of bound with the ideology of you are becoming a pharmacist. You are being trained in a specific profession rather than having that general set of science classes that you might be taking in your undergraduate coursework if you're studying in the sciences. Especially in undergrad, you might come across a lot of different folks from different paths going into different directions. I studied at UCLA, studied molecular cell and developmental biology. I had a very rigorous scientific training in UCLA. A lot of my classmates ended up doing a PhD in molecular biology or ended up going to med school. So it is very different mindsets, and you come across also a lot of different people that go into engineering or might do something completely different. So you don't have that sense of community that you might get in pharmacy school or in a professional school. Also, as a student in pharmacy school, you are held to different standards. There is a lot more higher expectations from you in the professional sense because you're not only learning, but you are also representing the profession. So your professors, your preceptors, your colleagues at work do hold you up to a high standard. And also you get a lot of different, I guess, treatment from the professors because they know you will become a future colleague. So a lot of the time it's more of them treating you already like a colleague rather than that student that is just trying to get by and get an A in their class. So very different treatment and just mindset.
What did you think about the intensity? Some of your busier quarters at UCLA versus your busiest year, which is usually your second year in pharmacy school, correct?
Yeah, so pharmacy school does come with a very preset schedule, preset curriculum that you have to follow. Your classmates follow you in every class throughout the course. At least that's how it was at UCSF. It also is a 3-year program. So it is an accelerated program. We didn't have summers off. So it was really intense because coming into the program, you had to actually know what you wanted to do from the get-go, because you don't have much time to do it, because you will already be applying to postdoctoral programs like fellowships or residencies at the end of your second year. So you really have limited time to do whatever you need to do and get all those experiences. So because of that, it did attract a lot of predetermined and a lot of students that were already, set on their goals after pharmacy school. So that was the biggest distinction between UCSF and other pharmacy schools. Also, it is very clinically focused. So a lot of my classmates, I want to say maybe 80% of them went into clinical work, primary residencies, or ended up getting jobs in hospitals. So it does really prepare you for clinical work as well. But it was rigorous. Definitely, there were a lot of times where a lot of my classmates and I were thinking maybe we should have done a 4-year program. And I think 3 years is definitely useful, because then it kind of saves you time in doing that 1-year fellowship program, 1-year residency program, or most fellowship programs are 2 years now, but residency programs are 1 year still. So it saves you time to do that extra year, saves you money. And at the end of the day, I feel like we still got that quality education that we would have gotten any other pharmacy school, really.
And speaking of quality education, I mean, you went to UCSF. It's probably one of the best pharmacy schools in the country. How did you end up picking it over some of the other options? And I'm sure you're glad you went there, but what was unique about it that you really liked?
Yeah, when I was applying to pharmacy school, I wanted to really hone in on my clinical skills, and I wanted a school that was scientifically geared and focused. So UCSF combined both of those aspects. It is they have been the first place in NIH funding for 40 years and still running as a pharmacy school. So they have cutting edge research. You have, faculty that have won Nobel Prizes. You are learning from the top of the top. Your professors, have done research in very cutting edge technology. So that obviously that was the first attraction. Second of all, the clinical aspect as well. You are closely working with the medical school, the dental school, which are also top-notch in the country. You are working with, when you get your rotations, your third year of pharmacy school, or your last year, is full of rotations that you do through different departments and hospitals and different settings of pharmacy settings, work settings. And you are working with the most brilliant minds, residents, nurses, doctors alike, and also pharmacists. So you are those two definitely made it very appealing. And that was my first instinct, to go and get the best education that there is. And then second of all, I already touched on it. The 3-year program was really appealing. And also I went into pharmacy school knowing I wanted to go into industry meaning pharmaceutical industry. And I knew that UCSF is located in a unique hub of biotech companies. So I would have a lot of easy access to a lot of those biotech companies that I could work in, which ended up happening. I mean, I worked in a consulting company that was based in SF, but it was still a very good experience.
Very good. And what's interesting is UCSF is really known for their intense clinical experience. Besides your bread and butter, say hypertension, diabetes, they're at a tertiary care center, a lot of rare disease states. So you have, exposure to clinicians using drugs in very, very unique scenarios, a lot of orphan disease states. Did you enjoy that part of it? Sort of the
Yeah,
complexity of the patients?
yeah, definitely. We do get hyper specialized pharmacists who were you might not get in a community hospital, in a random neighborhood. We did get a lot of pharmacists that were hyper specializing in a specific pediatric oncology, or things like that. So you do get a lot of specific focus on different aspects. It does kind of pigeonhole you in another sense, because you do have to be general in pharmacy for your job prospects, but you do get a lot of those examples of pharmacists who are thriving, doing very high level and high impact role, supporting a lot of the doctors in the hospital, especially ID pharmacists. UCSF was really big on ID as well. And we had brilliant pharmacists working in the infectious disease department. I unfortunately didn't have that opportunity, but a lot of my friends from their experiences, I've heard it was really rewarding and very rich experience.
Yeah. I think it's important for students to know that not every pharmacy school is going to offer that same menu of experiences, because if you're not looking for a tertiary care experience, you're not really interested in orphan diseases or clinical trials. If you just want to do bread and butter pharmacy and then go work retail, and you get into UCSF, you may not enjoy it there.
Yeah,
Especially all of that packed into 3 years. It's a competitive environment. Everyone's interested in research. You may very much not be happy there. Would you agree?
definitely. Actually, part of our curriculum is for us to do a research project. You have no choice. You have to do it. It's part of your graduation package. So it does definitely, if you do not enjoy research or clinical work, pharmacy school, or probably UCSF more specifically, would not be for you. We were taught like clinicians.
Yep.
That was the primary clinical. That was the primary skill set that we had to acquire, detail-oriented and clinical thinking.
Yeah. And I do think there's this tendency in undergraduate, because things are grades based and achievement based. They look up a lot of these school rankings and say, well, UCSF is always in the top five, and I'm always top five, so I should aim for a top five. And they should kind of get away from that thinking. They should look at it as, well, these are my actual interests. If
Yeah.
I'm not interested in that, you're not going to thrive over there, and vice versa. If someone is specifically interested in a research oriented track, they want to be a specialized pharmacist, or they want to go into industry like you, they probably should not go to a pharmacy school that doesn't have those collaborations. So it ends
Absolutely.
up being on what you really want. So I mean, and thank you for that feedback. So coming back to some of the other things we talked about. So I know you initially, like your sister, had an interest in industry, but what really convinced you when you were at UCSF that, what, it's a big choice. I'm not going to go into retail pharmacy initially. I am going to enter the industry, and it's a big commitment because you don't just do industry for 1 or 2 years. You're looking at a 1 decade of your life that you're putting into it to really become a professional, but at the same time, you're gonna have minimal clinical experience. Maybe you'll keep, what, 1 day a week, for example, just to keep your license alive, if even that, right?
Mhm.
How did you make up your mind?
Yeah, very good points that you touched on already. So I decided to go to work in drug development when I was working in a research lab before pharmacy school. I worked in radiation oncology at UCLA, and we were involved with clinical trials. That was part of my job. And that's when I learned about clinical trials in general. And I had decided then and then that that's what I want to do, at least for the foreseeable future. And because it kind of combined both clinical thinking and also research. And I just loved doing research already. I just didn't want to be cooped up in a lab my entire life. So, and although I did enjoy direct patient care and interaction throughout pharmacy school, I just felt I had a bigger impact when I was working on a bigger level project where I'm going to be able to affect possibly hundreds of thousands of people's lives. I did when I went into pharmacy school, I had that mindset of I want to have a wider impact. And I did have clinical pharmacy as a choice, as an option, and I did explore it. I worked as an inpatient pharmacy intern at SF General, which is a trauma center as well, and I had excellent pharmacists there and training. And although I enjoyed clinical work, I just didn't see myself doing that long term. And I just wanted to work more on clinical type of work, and also, again, like I mentioned, have that wider impact on people's lives. And that's how I ended up choosing industry. Yeah.
So being somewhere like UCSF, what proportion of your class would you say will probably end up in industry? It's not uncommon, right? Would you say it's at least 5 or 10%?
Yeah. So we were 120 people in the class, that about 120, I believe, and about 20 of us were interested in industry. And that's a big number.
Yeah.
Not Industry is usually something that pharmacists and MDs alike, people discover later in their career. Usually off right fresh off the school, most people do clinical work or community, like your retail pharmacy. So my class would specifically had a higher number. I think we were more attracted to CSF because of that biotech component, San Francisco, being a biotech hub. And a lot of my classmates actually were interested in clinical development, the subspecialty, I guess you could call it, that I am working in right now. So it was a higher number than usual, especially when I speak to other pharmacists that are coming from different schools. Everybody tells me, oh, there was only 1 or 2 people in my class who were interested in industry. So it's not common, but there is more and more interest. There's higher and higher interest coming in, the students who are coming into pharmacy school that are becoming more interested in industry. I think both because of the current state of the pharmacy profession, kind of moving away from the retail dispensary way and more specialized profession where we have specialty pharmacies popping up, clinical pharmacists getting more and more prominent roles in the hospital environment. And also, I think just in general, technological advancement in the drug development process has also opened a lot of new doors for pharmacists to work in. So, and I think a lot more of us are communicating that back to the pharmacy world. I can't tell you how many pharmacists don't even know about all the opportunities there are for pharmacists just in industry alone. And I'm not even talking about managed care, ambulatory care, radiology pharmacy, and that's besides clinical and retail pharmacy. So there is lots and lots of different opportunities. It's just a matter of you learning about it from pharmacists that are already in that field, and also seeking out that information, because I guarantee you it's out there and there will be somebody that will be willing to help you. It's just you kind of taking that initiative and telling yourself, I like this, how can I make this a career for me? And just going and do that research.
Yeah, I was pretty surprised recently. A couple of years ago, I took an interest in, drug prices and manufacturing. And, my first question was, well, I have access to pharmacists. I should ask them about the drug manufacturing end of things. And I was just amazed that they had no exposure to industry.
Yeah,
Zero. I think it just reflects how pharmacy schools tend to operate and the relationships they have with industry, mostly a lack thereof. So, and I do think you bring up a really important point about being in San Francisco. There's a couple of sort of tech hubs in the country, which are going to be really important, I think, for pharmacy students that want to at least contemplate a career in industry. I think San Francisco is an amazing place to be. Boston, New Jersey, obviously,
Jersey.
Seattle, maybe a little bit of Portland, but other than that, San Diego, obviously. But besides these 6 or 7 hubs, I mean, it's going to be pretty hard to get those experiences unless you have a very particular professor that has those. But you want to be somewhere where even if you go to the coffee shop on Saturday morning, you're going to bump into somebody that's part of a small startup or wanting to do something differently than it's always been done before. And you want to be like in that mental milieu, that ecosystem to, get your mental juices flowing because, these are not like fellowships that you just apply for, get in, and everything is on autopilot. You got to sort of eat, breathe, and, defecate this stuff, to be honest. It's not a passive process. Would you agree?
Oh, definitely. I will say UCSF really focused on clinical work. We, as a student interested in going into industry and fellowships, they did try their best. However, I never got the hand-holding that a lot of my classmates got that were applying to residency. I can't tell you how many events and meetings there were just so for people to help them apply for residency, but we got no guidance to fellowship. So it was a lot of self-research and a lot of my self-motivation that helped me, find kind of carve my path into fellowships. And definitely the fellowship process is not easy. It is very competitive and it's getting more and more competitive each year. There's lots of good candidates and not many positions. It's definitely fewer positions than residency. And especially because when you apply to a fellowship, it's not, there might be some programs, but a lot of them are specialized. So you already have to know which specialty, I guess you have to go in. We call it functional area. So you have commercial, you have medical affairs, you have regulatory, clinical development, and some also preclinical ones, and also pharmacology fellowships. So you have to do that self-discovery, and a lot of that comes from summer internships that a lot of students do, which I lacked as a UCSF student because we didn't have summers off. So I had to kind of create my path by applying for a consulting job because that was the only industry-related job opportunity I could find that was year-long because I didn't have summers. I tried to get my API rotation. So I had to be creative. I had to find other opportunities to set myself apart and also get those experiences. So I made sure that I get API rotations that were in industry. I did one at BD Biosciences in market access and another one at Ultragenics, which is a rare disease drug company in health economics outcomes research, just to kind of discover and try out other functional areas in industry. And also did research. And surprisingly, there was a lot of interest. Pretty much every company asked me about my research experience, both at UCSF, because I also was able to do some at UCSF. I had publications both from my research experience at UCSF and also from my API rotations in industry. So that was really valuable to showcase, and also some of my research experience before pharmacy school. And I think that was more, the recruiters were more interested in that because I was applying for a more research focused job role. So so even if you can't find those opportunities, I think research, you can always do research. And that's when UCSF's breadth of access to lots of top-notch PIs and labs came in handy, because I actually did my research with Dr. Su Guo, who won her mentor the Nobel Prize when she was doing her PhD. So, you're working under those types of people and they do guide you, but at the end of the day, you also have to kind of create your path. So in that sense, UCSF may not be the best or the easiest school to get a path carved to industry. That being said, I think how many 15 people applied to industry or to fellowship roles? I believe 12 of us got positions, and 2 of them also got a full-time job in industry, which is really hard to do coming right off pharmacy school. So it's doable, it's possible. It's just what you do in pharmacy school. We also did a research project with IFO. It's Industry Pharmacy Organization. It's short for that, and we were able to do a competition as a class of students. Those 15 people that I was telling you about, we all did a competition where we actually won first place nationally among 60 schools, and we were able to present that project at the Bladder Cancer Advocacy Network. So in front of bladder oncologists. So you have to also kind of create your own opportunities. It's just a matter of motivation and your willingness and asking for help. You can also, do research projects with faculty, ask people, ask for help. I think that's the biggest part of it as well.
Yeah. What's interesting is you were mentioning there were about 15 of you and only 12 got the fellowship, and that's coming from UCSF. It just shows that two things. One, how competitive these are. Second, just because you go to a great school and you probably have good grades, there's no guarantee because there's only a limited number of spots. I mean, Aline on the other video series is mentioning just through Rutgers, there were 300 positions, but who knows the number of applicants there are. So I think it's important for students to realize they should plan early on for these things. Just because 85% of the class is going into retail doesn't mean that, oh, just because you're part of this smaller group, there's some guarantee because 85% aren't headed in that direction. Not at all.
No, you are competing with students from other schools across the country. And
PhDs. I mean, there's plenty of PharmD PhDs out there that are dying to get into these industry positions.
Yeah. And actually pharmacology fellowships, whenever a student asks me about, applying to a pharmacology fellowship program, I would caution them about having to compete with PhDs. And I remember actually talking to a student from Boston who had graduated from, I think, Boston, Massachusetts College of Pharmacy. And he was telling me how you would think that it's easier to get job in industry, but it's hard because then you're competing with PhDs from MIT and Harvard. So you have to kind of take those into considerations. I think there are a lot of schools that are geared towards industry, like Rutgers has a really big presence in the pharmaceutical industry. And that's, I think, because of just the pure location of the school. We are surrounded by, you throw a rock and you will hit a pharmacy like a pharma company here. So there is a lot of pharmaceutical companies here. So I think it just happens to kind of align, but also I think USC also offers a lot of good opportunities because it also has a 4-year program. You have the summers to take, to do rotations. So I don't think your school will limit you. It's just what the work that you put in. Of course, I think as long as it's a reputable and a solid school, I think the work you put in, you will get out, no matter what the circumstances are.
Yeah, very good. So we do have a few more minutes. I just wanted to ask you, so, for a lot of the students that are watching this video series, maybe some of them are, even in high school, maybe they're at a community college transferring to a 4-year, or they're in the 4-year right now. The most important takeaways for getting into pharmacy school and, essentially surviving.
I think the biggest advice I can give them is follow your passion. I think that's going to be your drive. When things get tough, knowing your goal, knowing what motivates you will get you further. So follow your passion, do what you love. Very cheesy, I know, but it's true. And it comes, I was just doing work earlier, and being amazed and loving what you do really will make your life just much better. So do what you love and work hard. And again, I everybody will, in every path, wherever path you're coming from, you have to put in the work. None of it comes naturally to any of these accomplished people that you see in your life. So work hard and be resilient. It will be very tough. There were times where I wanted to give up multiple times, but that passion, that drive, that motivation will allow you to have that resilience to keep going, to wake up the next morning and do the thing that you don't want to do. Do the retail pharmacy rotation that you might not be enjoying, but you know that you're going to be applying for a fellowship. You know that you're doing these X, Y, and Z. On top of school where you are trying to distinguish yourself, you're gaining those skill sets. Invest in yourself, seek opportunities to both learn about different things and learn about yourself. And in that process, you will grow and you will acquire the skill sets that a lot of recruiters will be seeking out in the future.
Absolutely.
So
That's why I really encourage all the students that listen to it, come to the Armenian Medical Society events, meet people. You know, we have a really strong network of people. I mean, they really underestimate the different types of subspecialists that we have in our organizations, and a lot of people that are not necessarily part of their organization, they're a phone call or away or an email away. And the more people you talk to as a student, the more ideas you explore. It is not just in the textbooks. You really have to get out there and meet people. And sometimes you do have to meet 100 people in the same profession. And finally, that 100th person has some unique story or situation that you're in where you're like, okay, aha, I think I'm going to emulate this person. And then your life just changes afterwards. But you have to be willing to get out there and meet people. So, Mirna, really thank you for your time. Very proud of you, Dr. Kalayjian. So, looking forward to having you on next year for season 2.
of course, thank you so much
Very,
for having me.
very good. Bye bye.
Bye-bye.